There's shame attached to this, embarrassment attached to it. So your self-esteem does take a hit. You don't feel as good about yourself. You're worried about what this is going to mean to your partner, how that's going to affect that person.
External genital warts are lesions that are very common. In fact, it's one of the main reasons we see people in the context of sexual health in any kind of settings. These warts will present as small bumps or lumps in the genital or anal areas. Most patients will have absolutely no symptoms. And if they have symptoms, they will be quite minimal, such as a little bit of itchiness or a little bit of burning.
I mean, the first thing you have to remember is being told you've got genital warts is probably the most terrifying thing you can be told, especially because to the everyday person, they don't know what that means. They know what it looks like. They don't like what it looks like. They don't like that they're going to be stuck with it. So typically a patient is very, very afraid and wanting more information.
Genital warts are usually transmitted by contacts. Rubbing of the genital area, penetration, or even kissing the genital area might be sufficient for transmission of the virus. And we know that the proportion of people that will have acquired the virus from a partner, about 2/3 of those will have developed genital warts within 3 years.
Genital warts is caused by HPV. HPV, standing for human papillomavirus, is a virus that has several strains, and they've numbered these strains, HPV1, HPV2, 3, 4, 5, and it goes on and on. So they've isolated the 6 and HPV11 to be genital warts. First, that whole element of going into a doctor's room, pulling down your pants, showing your genitalia, showing these awful, bumps that you've been maybe hiding for, gosh, I don't know how long you maybe have already had them. You're worried what this doctor's going to say, what that's going to mean in your life. Then finding out about the treatments and how many times you're going to have to go back.
Genital warts are treated in various modalities. So there are treatments that can be given at the physician office or at the hospital. So usually they consist of destroying the skin with laser, with electricity, with surgery, or there are treatment modalities that the patient can apply himself or herself at home. So we can use Condyline or Vortex. So this is an extract of a toxic substance that will slowly burn away the lesion. There's also imiquimod available under various names or in various percentage. So in Canada, we have the 5% application, Aldara. There's a newer concentration, 3.75%, sold under the name of Viloma, that shortens the treatment. And there's a new therapy, Verigen. This is a treatment consisting of synicaticians. It's supposed to halt the multiplication of the virus in the wart. When patients are found with genital warts, it's very important that they be offered screening for other sexually transmitted infection. For those who are smoking, certainly a good discussion about smoking cessation is very important. And for women who did not have their pap smear, certainly it's the time to take a pap smear. It is also the occasion to discuss about HPV prophylactic vaccine. We know that there are some benefits for the patient who are having genital warts and of course for their actual or their future sexual partners.
To learn more about external genital warts and treatment options available, talk to your doctor and visit healthandfamily.ca/EGW.